Hello everyone. In this video, I'm going to talk about metoprolol. Metoprolol is one of the widely prescribed beta blockers, and it is well known under the brand names Lopressor and Toprol XL. Metoprolol has good bioavailability after oral administration. Actually, this medication is available as a racemic mixture of R and S isomers. This medication is available in two formulations, metoprolol tartrate and metoprolol succinate. In both of these formulations, the medication is the same. However, it is presented as different salt. Metoprolol tartrate is mainly present in the immediate-release tablets, whereas metoprolol succinate is mainly present as extended-release tablets or capsules. Nowadays, extended-release formulations are more preferred because of the prolonged release of this medication throughout the day, reducing the blood pressure for longer periods. In this video, we are going to discuss essential things that are required to know before use of metoprolol, like how this medication works, how to take this medication, and what are the important precautions and side effects. First of all, let us see where it is used. Metoprolol succinate extended-release capsules are used to treat hypertension. This medication can reduce your blood pressure, which reduces cardiovascular complications. People with high blood pressure may have an increased risk of strokes and myocardial infarction. Metoprolol can selectively block beta-2 receptors on the heart, thereby reducing the blood pressure. A small reduction in the blood pressure may have a significant reduction of risk of cardiovascular complications. Metoprolol can be used either alone or in combination with other antihypertensive agents to reduce the blood pressure. Second clinical use of this medication is in the treatment of angina pectoris. For this purpose, metoprolol can be used for long-term treatment, where it can reduce the pain that is associated with angina. This medication can also be given to reduce the risk of mortality as well as hospitalization in the patients with heart failure. It is also used in the treatment of myocardial infarction given by intravenous route. How to take this medication? Metoprolol is available as extended-release tablets or capsules. It is available at different strengths, starting from 25 mg to 200 mg. Even it is available as 12.5 mg tablets in few countries. Always start at lower doses in order to avoid hypotension and bradycardia. For the treatment of hypertension, metoprolol extended-release tablet or capsule, it can be taken in between 25 to 100 mg. You can observe the reduction of your blood pressure after 1 hour of administration. For treatment of congestive heart failure, Metoprolol started at 25 mg initially. The dose can be increased every 2 weeks based on the response. For the treatment of angina, it can be given as 100 mg per day. Metoprolol is metabolized by the cytochrome P450 system in the liver. This is an oxidative metabolism where metoprolol is converted into its metabolite by one of the enzymes CYP2D6. However, the activity of this enzyme is not the same in all the people. Few people are poor CYP2D6 metabolizers. Metoprolol is less metabolized in them, leading to elevation of its plasma levels. Therefore, even a small dose of metoprolol can produce an effect that is equal to a higher dose of metoprolol in people with poor metabolizers. In such people, metoprolol should be carefully used. Because of a higher effect, even at smaller doses, the receptor selectivity may be lost, resulting in the more pronounced side effects in such people. How it works? Metoprolol works by reducing the activation of your heart. The sympathetic system plays a key role in stimulating the heart and increasing the contraction of the heart. This can be mediated by activation of beta-1 adrenergic receptors located on the heart. Metoprolol selectively blocks these beta-1 receptors. It results in a reduction of both rate as well as force of contraction of the heart. This reduces cardiac output. Afterload can be reduced, which can reduce arterial resistance. Because of decreased cardiac functionality, both systolic and diastolic blood pressures are reduced. In this way, metoprolol can reduce the blood pressure as well as it can reduce the excessive cardiac activation. It also reduces cardiac workload. This can produce a protective action on the heart, reducing further complications in people with cardiovascular disorders. Now let us see where it is avoided. Use of metoprolol is avoided in a few situations where it has a significant effect on your heart. In people with sinus bradycardia, use of metoprolol should be avoided. If you have a heart rate of less than 45 beats per minute, metoprolol is not recommended for you. In people with second-degree or third-degree heart block, metoprolol is contraindicated because it further reduces the AV conduction and increases the risk of heart block. However, in people with severe first-degree heart block where the PR interval is above 0.24 seconds, again, this drug should be avoided. If you have any symptoms of moderate to severe cardiac failure, metoprolol should be avoided because it reduces the force of contraction. In people with systolic blood pressure less than 100 millimeters of mercury, again, this medication should not be used. Use of metoprolol is also contraindicated in people with cardiogenic shock. In such people, the rate of contraction of the heart is reduced, and metoprolol can further reduce the rate of contraction, thereby increasing the risk of cardiogenic shock. What are the important precautions? In people with bronchospastic disease, metoprolol should be carefully used. Metoprolol selectively acts on beta-1 receptors. These beta-1 receptors are located on the heart. Therefore, it is specifically acting on the heart. However, if you have any bronchospastic disease, metoprolol should be carefully used. The receptor selectivity may be lost when you use metoprolol at higher doses. It is also variable in people with poor metabolic capacity. Therefore, at higher doses, metoprolol may block beta-2 receptors, which are located on the bronchial smooth muscle. This may result in the bronchospasm and difficulty breathing. So if you observe any difficulty breathing with the use of metoprolol, you should immediately talk with a doctor. Sometimes you can avoid bronchospasm or difficulty breathing by adjusting the dose. Instead of taking it 2 times daily, it can be divided into 3 doses and taken 3 times daily so that the plasma levels of metoprolol are reduced. When the plasma levels are reduced, the beta-1 selectivity increases, and it specifically acts on your heart with fewer effects on your bronchial smooth muscle. In case of a toxic dose of metoprolol, you may have bradycardia, decreased heart rate, and severe hypotension. In such conditions, a beta agonist can be given to restore the heart rate. However, they have less effect on restoring hypotension. If you have diabetes, you may be associated with fluctuations in your glucose levels. When you are under treatment with anti-diabetic medications, they may produce hypoglycemia as one of their important side effects. This hypoglycemia can produce a few of the symptoms like dizziness, sweating, and tachycardia when you take metoprolol. The tachycardia may be masked, and you may not find the real symptoms of hypoglycemia. This may increase the prolonged or severe hypoglycemia, particularly when you are under fasting or when you're going for surgery. Therefore, if you have diabetes, you should carefully use metoprolol and check the symptoms of hypoglycemia. This medication can prevent early warning signs of hypoglycemia, such as tachycardia. If you are using metoprolol for treating tachycardia, check any underlying conditions. Suppose you have a condition called pheochromocytoma, you should not use the metoprolol initially. Pheochromocytoma is a condition of an adrenal tumor that increases the release of adrenaline that may act both on the alpha as well as the beta receptor. Therefore, you should use both alpha and beta blockers. So before using metoprolol, you should use an alpha blocker to avoid any paradoxical increase in the blood pressure. Using metoprolol may mask the symptoms of hyperthyroidism, elevated levels of thyroid in your body. When thyroid levels are elevated, you may have symptoms like tachycardia, but this tachycardia may be masked by the use of metoprolol. Therefore, if you have any previous hyperthyroidism, use metoprolol cautiously. When you are using metoprolol along with a digoxin, it may have 2 effects. Digoxin increases the force of contraction, whereas metoprolol reduces the force of contraction. So when you take the metoprolol along with the digoxin, the action of digoxin may be reduced. The second effect is that both of these medications can reduce the AV conduction or atrioventricular conduction. So when you combine the metoprolol with digoxin, a significant atrioventricular block may be produced, which may impair the cardiac function. If you are already taking digoxin, its dose may be properly adjusted. Metoprolol can reduce the cardiac contraction and depress the cardiac activity. So it may increase the risk of heart failure or even increase the risk of cardiogenic shock. Use of metoprolol can also increase the risk of angina and heart failure, so if you find any symptoms, use it with caution. You should not use metoprolol at a much higher dose initially, particularly when you are using external lease tablets. Using at higher doses may increase the risk of bradycardia, hypotension, and even the risk of stroke can be elevated. When you're using metoprolol for longer periods, you shouldn't stop it suddenly. Particularly in the case of ischemic heart disease, you shouldn't stop this medication suddenly, and the dose of this medication should be slowly reduced over a period of 1 to 2 weeks. At higher doses, metoprolol loses beta receptor selectivity. Even the loss of receptor selectivity can be observed in the poor metabolizers. Metoprolol can cross your blood-brain barrier, and it may increase the risk of CNS depression, so in people with a history of psychiatric illness, it should be carefully used. Take caution when you're going to take the hydralazine along with metoprolol. Hydralazine is a medication that is going to be used to reduce the blood pressure. It is a vasodilator. This medication can reduce the metabolism of metoprolol, so it may increase elevated levels of metoprolol and increase the risk of metoprolol toxicity. Side effects. Most of the side effects of metoprolol are mild and transient. It can produce some tiredness and dizziness that is commonly observed. In a few people, it can also produce some confusion and a short-term loss of memory. Headaches, nightmares, and insomnia are also observed. This medication can also produce shortness of breath and bradycardia. Cold extremities and hypotension can be observed. Very rarely, this medication can produce some rash and itching in the people. Abdominal pain can also be observed. These are the essential things that you should know about metoprolol. That's all, guys. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.